Hello, friends. In this week's episode, I sit down with the brilliant, compassionate, incredibly intelligent Dr. Lori Bouchard. She is my naturopathic oncologist. I could not be more grateful for her and her team on this journey of healing my body this year. She has been such an incredible resource for me and so many others. I could not wait to bring her on the podcast. In fact, I actually had our interview originally scheduled for October, and unfortunately, with some of the complications that I was having with inflammation in my body, I wound up in the hospital. So we had to reschedule. But I feel like I wanted to be very strategic with the way that I lay out these podcast episodes, and her being one of the forefront leaders to really kick off the conversation around naturopathic and metabolic health. Dr. Lori has over 15 years of experience in cancer care, and she's helped thousands of men and women overcome cancer and live a better quality of life. She is an expert in the metabolic approach to cancer and has written 2 best-selling books on the topic, Cancer Doesn't Own You and Live Longer and Stronger with Breast Cancer. Dr. Lori is also a certified terrain expert under Dr. Naisha Winters and a member of the Oncology Association of Naturopathic Physicians. So this episode was so important to me to really kick off the interviews. Of course, you've seen me talk to my husband, my conventional oncologist, but this way of healing is something that I gravitate towards because I have that lens of holistic health, being a health coach. So finding a practitioner that would work with me and dive into the root causes of what's going on and help me understand how I can better heal my body, it has been such a game changer. Dr. Lori and I get more into detail around keto diets, around fasting, why they're important and how they make an impact on a cancer diagnosis, and when she would recommend it or not. There is no one-size-fits-all approach to treating cancer, and I think this conversation makes that very obvious. Even if you have the same diagnosis as someone else, it is completely unique to the individual. So we talk about things like the metabolic theory around cancer and how that's very different from the way conventional medicine tends to look at it, the differences between naturopathic care and conventional care. We also cover a little bit more specifics around me and her lens and way of looking and diving deeper into what was going on with my health, really uncovering some of the terrain and some of the root causes, and then how do we course correct. It's such a beautiful conversation that we had, and I have been working with her over the last year, so she knows me well. She also wanted to be very sensitive to me as to what I did or did not want to share, and I told her, as you know, I'm an open book. I think the more that I can share about what's going on with me, but also have it come from her lens as the expert is really, I hope, going to open people's minds, open people's hearts, maybe make people think twice about looking at your diet, your lifestyle, examining your stress, examining relationships in your life, or things that are triggering, looking at your gut health, your viral load. How can you cure that before you are at the point where you're faced with a giant diagnosis like this? Whether you have an autoimmune disease, a cancer diagnosis, or some other chronic condition, or you're just looking to be proactive with your health, so many people will gain valuable insights from this conversation. And now I do just want to let you know that I had some questions pre-planned for her. I had a huge list, and I, of course, wanted to be respectful of her time. I wanted to dive into as much detail as we could, and that being said, we had to limit some of the questions. So we may come back for a round 2 because she is just such a wealth of knowledge and can really go so much deeper into some of these topics than we were able to with our time. I want to thank Dr. Lori for showing up and giving me her time. Hopefully there are lots of nuggets of wisdom after listening to this podcast. If you or someone you know is going through a healthcare diagnosis, Dr. Lori was gracious enough to offer a free 30-minute strategy call to anybody listening to this podcast. I will include the link below and share a little bit more about that as we talk about my experience with the metabolic cancer reset program that she created. I have weekly calls with her and her team, but also other people who are going through similar things. So if that is something that piques your interest, stay tuned and listen for more information. Thank you again, Dr. Lori, and please enjoy this episode. Hello, friends. Welcome to the Forward Think Tank podcast, a place for sharing stories of hope, inspiration, and wisdom on all things holistic health. I'm your host, Jamie Mazza, a holistic health coach and lifelong dancer. After being diagnosed with a rare thymic tumor and autoimmune disease, I am on a mission to fully, radically heal. Tune in as I share stories from my personal healing journey, interviews with forward thinkers and healers in the wellness industry, and stories from incredible humans who have gone through their own health challenges and continue to move forward in hope. Thanks for tuning in. So grateful you're here. Hello and welcome back to the Forward Think Tank podcast. I am so thrilled to have Dr. Lori Bouchard. She is my naturopathic oncologist. She's incredibly brilliant. Dr. Lori, thank you so much for being here with me. I am so excited to have this conversation with you.
And I think we're going to go in so many different directions. So thank you for inviting me onto your podcast here.
Yeah, of course. I've learned so much from working with you and Dr. Janet, who I also hope to have a conversation with here. And I know I asked you a lot of different questions, some from which came in from other people. So we'll get through as much as we can. And if we do need to do a part 2, we can certainly do that. Let's just dive right in because you're such a wealth of knowledge. If you can tell me, and everyone who's listening, about your expertise working with cancer patients and helping them heal, I think this is going to be eye-opening for everyone to answer this piece. How is the naturopathic oncology approach different from conventional medicine?
So it's a great start to this interview because a lot of people feel like you have to choose one or the other. And they think, should I go the natural route or should I do the conventional route where I have to do everything my oncologist says? And I would love to live in a world where it is integrated and we can take advantage of both worlds. The way that I see conventional oncology is very much like there's a building burning down. We need firefighters coming quick. Let's do all the things to put out this fire and bring the flames down. And, let's deal with this situation in the fastest, most aggressive way possible. So that's conventional. Let's do what you need to do to get this cancer under control and make sure that it's not essentially taking your life from a disease that has progressed in a certain way. Naturopathic oncology and naturopathic medicine is more about, why did that fire even start in the first place? Why is there a fire there? What is fueling this fire to happen? Why are these flames out of control? And now, once the fire is gone, how can we change the foundation of this building and the ecosystem around this building so then this fire doesn't happen again? So it's very different approaches of medicine. One is emergency situation. Let's do what we need to do. And then the next is, okay, let's understand the whys. Let's really try to dig deep and what is going on in the body. And this was the case 15 years ago when I graduated naturopathic medical school. My first patient who had cancer, he was in a wheelchair, literally at death's door. His family was saying, if he did one more chemo session, it would take his life. So he came to me as a very last resort to saying, what else can I do? Because I have a lot to live for. I'm not ready to die. He was about 61. He said, I want to see my grandchildren be born in a few months and I'm not ready to go. And so at that point, as a new graduate, I'm thinking, well, if the best of conventional oncologists can't help you, so I looked at this person not as a cancer sitting in my office. I looked at him as a human and said, okay, what is going on with your body that allowed this cancer to happen? And actually, for the first 6 months of him and I working together, it was a lot of detoxing, a lot of getting rid of the toxicity that pretty much killed him. Like, the cancer was not killing him at this point. It was the conventional drugs that were killing him at this point. And so this patient ended up thriving over 10 years in this palliative situation where he was in a wheelchair, literally told he had a month to live. So it's all about stepping back and saying, why is this happening to your system? What allowed this to happen? And really looking at what is stimulating its growth. And there's a lot of labs that we look at in the naturopathic world and I'm shocked to hear that are not even tested conventionally before a drug is even chosen. So it's very much, this is your cancer type. This is the drug that we use for this type of cancer, even though 5 different people with the same type of cancer can have 5 different origins and stimulators and things that are igniting this cancer to grow. So it's 2 very different worlds, and there is a time and place for conventional, of course. And you know that more than anybody, you know that there is times when you have to do certain things, but still being able to personalize it and support your immune system and support all the things that go alongside that conventional world.
I mean, thank you, because that just painted such a beautiful picture. And thank you for sharing that story. I had the chills of you talking about your first patient as you shared that. And I think that is something that's so beautiful about the work that you do and the work that Janet does. And Dr. Nasha and everybody trained under the metabolic approach, you're looking at us as human beings. And you're also looking at it as it's not a standard of care where it's one size fits all. It is what truly did cause the fire. And I have asked so many surgeons, oncologists that I met with, and I was very blessed to have reached out to you pretty early on in getting my diagnosis. So I felt like I was in good hands from the very beginning, where I was being looked at from every angle. But I feel from the work that you do, it is like, even if you do choose the conventional route, we're still going to support your whole body and allow you to bounce back and recover quicker and work on the detox and things that these doctors don't even consider or think about. And it's clearly not part of their training, which hurts me, but that is why the naturopathic world exists. And I hope that people listening will open up their minds and their hearts to this a little bit more, because it has helped me and countless others I know that you've worked with so much. So thank you.
In every aspect of my life, being a detective is so much fun. It's like,
right.
You want to know why, and you want to learn why it's happening in every aspect of your life, not just with a disease or a cancering situation. It's like everything in life should be, why am I doing that? Why is this happening? Not following the sheep of, oh, because they told me to do it. It's like, no, but why do I need to take that? And that's such an important thing in the naturopathic world, right? Of like, what are all the puzzle pieces that we need to figure out this unique situation and really understand what process is happening.
Yeah, it really empowers me, I think, as a patient because I ask all those questions. I know so many people do. They don't always get the answers, but it's also empowering me to be my own advocate and then utilize you as a resource to help me understand what's happening in my body. So it's been a very eye-opening year, to say the least. And I feel like I've gone through med school just by talking to you and learning from you each week.
Yes, everyone in the group honorary. Sorry, I was going to say everyone in the MCR group, everyone that I work with, I feel like to a certain point, you get an honorary degree in naturopathic medicine. And it's amazing the questions that I hear now versus 15 years ago, right? It's very like, wow, you're actually teaching me things. I'm researching into things and learning things. And it's such a huge field that learning just never ends. So it is really fascinating, and to have patients who are really wanting to learn and understand. So good for you, right? And anyone that listens to you really wants to understand their body better as well.
Thank you. And I do definitely want to talk about the MCR program, maybe a little bit towards the end, because we do have so many wonderful people in there. It's been such an asset for me. I want to ask you this question, and I know you're going to have a beautiful answer. I feel like it's a little bit vague, but especially from your chair, what is one thing you wish people understood more about cancer?
That cancer is not an enemy. That cancer does not have to be this enemy that we hate. It's actually your body's SOS signal that something has gone off, something has gone wrong, and something needs to be addressed and fixed. So if you think about your home, think your body as your home, you think about if you have a strong security system and immune system, right? If you have this strong foundation, really cancer should not be allowed to thrive in the body. So it's understanding the whys of what is happening with this metabolic dysfunction and where can we fix this surveillance. And when it comes to even like home invasion, like a burglar cannot come in the house if we have all of the wiring correct, if we have all of the security systems on guard, if all of the soldiers are in line, if we have strong foundations for how we let any kind of pathogens in, or how we even recognize an abnormal bacteria or something that is pathogenic, how does your immune system even recognize that? So I think about how cancer is in relation to a home security system. It really is. There's something that's gone off that allowed this process to happen. And so not looking at it as like, okay, this disease just happened to me and it's shitty luck. And it's something that, I don't know why I have it and it's not in my family. And, why did this happen? It's bad luck. it really is. There's multiple reasons metabolically that have become broken that didn't recognize this abnormal proliferation issue and damaged DNA and repair mechanisms, and how your immune system is recognizing these defaults is impaired. So it's really important to not see cancer as this punishment, or even to say it's my fault and have this guilt and, oh, I shouldn't have done this. It's from multi angles of why cancer can happen. And it could be starting from generations back and how your mother was with you in the womb, and starting off this cortisol imbalance and affecting tumor suppressor genes. And like the whole cascade effect happens from food, from toxicity, our environment, like hundreds of reasons of this perfect storm happening. So it's never just one thing. And it's our role to look around and say, what is allowing this to happen? What in my life is happening? A lot of patients say cancer has been such a gift, and they feel odd even saying that, but they feel that it's pivoted their lives in so many ways that they would never have done until they got this diagnosis. And they say they feel healthier than they ever had cancer. Post-cancer, they feel healthier than ever. And so language like, what can this cancering process teach me? How can my life change? What toxicities do I have in relationships, in my schedule, in my work? Where am I not happy? Where can I feel more gratitude and take life a lot easier and not so stressed all the time? So it really is an opportunity for your body, for your system to step back and say, where have things gone wrong? And let's reevaluate now.
Yeah, it's a total wake up call as you're sharing all that. I'm thinking, I have been somebody who's always thought, yeah, okay, eventually I want to change my career or work on my stress, or eventually I want to have a family. So you just move on with your busy life until something like this hits you smack in the face like a pile of bricks, and you're like, oh my God, like I was total deer in the headlights. But it allows you to come face to face with some very important questions and figure out what needs to change. That opens up your life from a truly different perspective, and hopefully allows you to embrace and make change for the better. I really resonate with that. I think this segues into another question. As you're talking about cancer as a metabolic disease, can you speak more about the metabolic approach and that idea of cancer as a metabolic disease and what that means?
Yeah, and so it's very different than a genetic onset of why you have cancer. So the somatic theory to cancer is very much, my mother had this type of cancer. It runs in my family. I'm destined to get it. There's no other way around it. This genetic issue is something that the cancer was just bound to happen. And that's where a lot of conventional theories come from, where this drug is for this genetic mutation. And it's very myopic in thinking. It's very like, this is what cancer really is it actually, the personality of it is constantly changing. So every time you do a chemotherapy, the expression of this cancer can be mutated and it can change. And so that's where people can develop drug resistance and stop responding to certain medications. So we know that it's not just a genetic default or a genetic flaw. It actually has more to do with the metabolism completely gone wrong in healthy cells. So the mitochondria becomes damaged and completely changes how the metabolism looks like from healthy cells to abnormal cells. And so cancer cells, they have all of them, every cancer, no matter what type of cancer that someone has, they all have damaged mitochondria and a faulty metabolic system. And so they require a lot more glucose than healthy cells. And so what happens in this mutation process and this metabolic dysfunction is they upregulate their insulin receptors. And so they have 2 to 3 times more insulin receptors than what healthy cells do. So you think about having anything with glucose and sugar in it, those cancer cells are, woo, let's have a party. Like, I need to use this fuel to grow. And this is something that all cancer cells have in common, is that they need this glucose as a form of fuel to help them survive. And what's really
I'm picturing these cancer cells like these roid ragers at the gym, just taking that all up like steroids and getting strong.
Exactly. So you could even see that with healthy cells of, you're feeding one pathway so often. If you're having so much glucose and so much protein and calories, like way above and beyond what your body needs, you're going to either, if you go to the gym, you're going to either gain lots of muscle, gain lots of fat. It's this growth cycle that is happening with healthy and abnormal cells. And so this is what we do not want in cancer, is for this proliferation and this growth pattern to happen. And I know for you specifically, and I did ask you before how much I could share, but we know that for you specifically, mTOR is a big part of your cancering process. And so anything that's driving this growth pathway of too many amino acids, too much protein, too many calories, too many insulin spikes throughout the day is going to have this proliferation effect on cancer cells. And that is just a fact of what is stimulating this growth. And this is for many cancers, that is a growth pathway that in general, it's stimulating proliferation.
Yeah. I mean, my mind was blown when I learned about that, because if I could look back to what I was doing the 3 years prior, as you know, I've shared on the calls, I was trying to get pregnant. So not only was I taking estrogen, which I've learned can be a proliferator in some cases, but I was also like really upping my protein, which I know is I don't want to say trendy right now, but it is trendy. So I was making sure to get my body weight and protein each day. I was snacking throughout the day just to keep me fueled and going, because I was running around the rat race in the greater New York City area, constantly on the go and stress. So that perfect storm combination, and then things we found out about like viruses undetected and many other things, sharing that with my conventional oncologist, they kind of dusted it under the rug. And they are the ones that help me run these labs. And even when things seem really elevated, they make zero comments about it. And then I know I bring it to Dr. Janet or to you on these calls, and then we really dive deep. And it's amazing to me how much you can see with the labs on a monthly basis. So it blows my mind that they don't consider that, even if they don't know enough about it. I feel like that is the beauty of what I've experienced working in the MCR program. You said sometimes people, patients come to you and present something. What I see you do, which I appreciate and respect, is if you don't know the answer, you dive deep into the research and then present that to us. And you're willing to do that because you realize it's not a one size fits all approach. Where over there, and I'm pointing over towards New York where my doctors are, it's just like, mum's the word.
And it's a very different set of training, right? It's 4 years of medical, I don't want to say brainwashing, but I'm also brainwashed in a certain way as well. Like what we throw ourselves into and who we look up to as mentors and who we listen to, of course, you're going to have that lens when you think about how you're going to change your life or how you do anything in your life. You're going to be very focused on what you believe in. And so that's no different from any other doctor training. They are experts in that field, and it's up to the patients to know who to go to for what. When is the time? What questions can you ask? How can I get the best personalized medicine and use them for what they're good at, but not expect them to really dive deep into the nutrition or to learning how to get rid of Epstein-Barr virus or to help regulate your immune system. Like just knowing which types of questions to be asking which practitioner, I feel like can save a lot of stress, because there's nothing worse than asking your doctor something, hoping for an answer that you were really wanting to hear. And you're like, well, they actually weren't even trained in that. So like, there's no way they would respond the way you want them to.
Right. So just to come back to mTOR, I think that can segue into talking a bit about the keto and the fasting piece. And I remember trying to wrap my head around it. It's like, okay, I don't want to set mTOR off. What do we do? And then I had this reassurance from you and then also from Adele. It's like, well, Jamie, it's what we've already been working on. It is the keto. It is the fasting. So can you tell me a little bit about why you recommend a keto diet to people? And is that always a one size fits all when you're working with somebody?
So when we think of growth pathways in general, mTOR being one of them that's driving this cell proliferation and growth. So think about, like you said, going to the gym, having tons of amino acids, like, loading up on protein, lifting heavy weights, you're eating constantly, getting insulin spike constantly. You want all these growth mechanisms to happen. Those are the meatheads that huge muscles, it's like that's what, not that they're actually meatheads, but that's what they are striving for, is this massive growth, right? So that's mTOR. With cancer, what we actually want is for your body to go into autophagy, which is the opposite. If you're looking at this scale, we need a balance of both. Like you can't suppress mTOR completely because you would be dead. And there is actual medications that do suppress mTOR, and it's affecting your healthy cells as well. And so you do need healthy cell division for your immune system, for hormones, for mood, for your gut. You need that process to happen to some degree. And that's why for you too, you're like, how can I just squash mTOR? I don't want this process to happen. But there's a time and place for it, and you do need it. So the opposite, so if you think of mTOR as up here, the opposite is when your body is going into autophagy, which is detoxing. It's when you're fasting, you're staying away from high calorie insulin spikes, you're getting rid of the high sugars in the diet, anything that could potentially spike insulin and sugars and affect this mTOR pathway. You're actually setting up the stage for a detox and getting rid of old damaged cells and allowing cancer cells to go into apoptosis. So this is like a programmed cell death that every cancer cell to some degree should be going into, but it's not allowed to because it's being fed all of these fuels to allow it to grow. When you just to go back to your question, is keto right for everyone? That is one method that is carb restriction. It is allowing so many calories from certain sources of macronutrients. So saying you can have get most of your calories from fat, moderate amount of protein, and extreme low carbohydrate. So that I do not think is right for everybody, where it's that extreme high fat, certain genetic predispositions do not allow for that and have issues with fat metabolism. So no, I don't think the standard keto diet is right for everybody. However,
hey there. If you are listening to this episode and thinking, wow, there is so much wisdom in here, I'm curious about the naturopathic oncology approach. Maybe you have a conventional team in place. Maybe you're freshly diagnosed and have no idea where to start. You're hearing Dr. Lori and I talk about the Metabolic Cancer Reset Program, which is a program she designed to help people going through a cancer diagnosis. It is heavy to sit with a diagnosis, and you may not get answers you need or support that you need from your conventional doctors, also from family members and friends. So if you're looking to support your health, get answers for what may be driving cancer in the first place, making tangible changes to your diet and your lifestyle, looking at a holistic lens to say, what can I do to support detoxification, digestion, to really strengthen my immune system and help to fight cancer and kick it in the butt, then this is for you. Dr. Lori was gracious to offer a free 30-minute strategy call for anybody who is listening to this episode, a loved one, a friend, family member, a colleague, or yourself. If you're looking to dive deeper into your health, be proactive, maybe you have genetic predispositions to cancer, so you're curious to learn what you can do to be proactive about your health, Dr. Lori is incredible. Her Metabolic Cancer Reset Program has truly changed the entire trajectory of this healing process for me. I'm so grateful to have her and her team, who is highly skilled and trained, in my corner. So if you're interested in a strategy call with Dr. Lori, I'm going to include that in the episode notes and description below. Check it out. Again, a free 30-minute strategy call to dive deep into your own personal situation. Because as we talk about in this episode, even if you have the same cancer diagnosis as someone else, nobody is apples to apples. We are all so genetically different and have different things in our environment that may contribute to this type of diagnosis. I encourage you to click on that link, set up a strategy call with Dr. Lori. I promise you will not regret it. It has been such a needed light in my healing journey. I hope you enjoy that gift. Thank you, Dr. Lori, for that gracious offer, and thanks for your support.
I do strongly feel everyone with a cancer diagnosis should be carb restriction, lowering these insulin spikes, lowering inflammation, allowing your body to rest and digest, having at least 14 to 16 hours of fasting throughout the night. And for some people who have massive amount of inflammation, high glucose levels, high insulin, all of these like high growth factors should actually be fasting longer. Strategically done isn't just like, okay, let's just stop eating for a week. As you know, there's a whole process of how to prep into that. But that really is the goal, like how to get your body so metabolically flexible where you can start now, instead of needing glucose to go through your day and to energize your system, you can go through this other source of fuel called ketones, and which is a much cleaner source of fuel that cancer cells cannot use to thrive. Very fasting and ketogenic diets are a way to get your body into this process of ketosis, this therapeutic level of ketosis, to help with this detox and anti-inflammatory system. So it is, you look at it as like two separate different pathways that you can't fast too much because then you'll be malnourished. You're going to not be fueling your body what it needs to thrive. But then again, you can't have, it is all a juggle act. And that's why we check labs so frequently to know, where are you at now? We're not guessing, okay, let's throw you into this pathway because we just feel it's the right timing. We want to see the data and actually make monthly decisions. How should your plan look this month? Okay, we've switched these things up. Now, how should it look? So we're constantly tweaking based on what your body needs. So not one diet fits all, not one protocol fits all. It really has to be so personalized to get the results we want.
I love that, because in conventional medicine, it's very much standard of care. Here's the drugs you're going to do. Here's what, how long you're going to do it, and yada, 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 send you on your way. They don't even really follow up. I noticed that, honestly, when I had the flare up. I know I shared a bit about that in a previous episode, and you obviously saw me through that. There was no follow-up. It was kind of like, okay, we wash our hands. You need to go talk to the neurologist. My oncologist, I had to call him. But in this case, working with you, it is very much, we're not guessing. We are looking at the facts, we're assessing, and we're making changes as we go. And I have seen that. There have been times where, especially in the beginning, I was fasting a lot, just really trying to get my GKI in a certain range and super hyper focused on that. I was seeing great results. I was able to do that. I was able to, I think, gain metabolic flexibility. And just talking about reducing inflammation, it's so important for me, especially with the MG diagnosis, to keep that down. So I remember you saying at one point when we were talking about fasting, you're like, sometimes, when I do eat something that's a little bit more like rich in carbohydrates, I notice it right away. Like I feel it. And after spending a weekend at my family's for Thanksgiving week, and maybe just being a human and trying, I hate using the words like be normal, but introduce some things into my diet that I really wasn't eating before, I did notice it right away. It's just like you get this brain fog, and it's kind of like, oh my God. So even if you're listening to this and you don't have a cancer diagnosis, but maybe you are constantly being fueled on carbohydrates and you're feeling the brain fog and like feeling achy and inflamed and not sleeping as well, it could be worth experimenting with some carb restriction. But as I always say, you want to do it intelligently, and working with somebody who knows what they're talking about, especially if you're not familiar with this, is the perfect way to go. How do you feel, to maybe elaborate a little bit more, how do you feel that fasting helps patients? I know we were talking about keto and how the carb restriction can help, but how does fasting help patients while they're trying to heal? And do you always recommend fasting to a patient?
Yes, fasting can be something as simple as 10 hours overnight while you're sleeping. It doesn't have to be this elaborate thing, but it really means you're giving your body a break from having to digest and work. And it's like a reset button overnight. And so someone who eats really late and then really early the next day and constantly, like, that is the worst way to have meals. And so to some degree, yes, everybody should be fasting. But if you have a chronic disease, that fasting picture would look completely different, because your system is crying for help. It's saying, please help me learn how to operate again and help me understand what is what. And so giving your body a break from food and from all of these mechanisms that are being spiked, healthy mechanisms too, when you're eating, giving your body a break from that is exactly what it needs. And so for use, especially with thymomas, think about your thymus as this it's a coach. It's telling your immune system what to do. And so a typical issue with thymomas is this coach is completely confused. It doesn't know how to effectively lead a team anymore, right? And so you think about, hey, what am I eating that's confusing this immune system even more? What supplements could I be doing that's now provoking more of an immune response? Or what am I doing on a hormone level, or how stress is affecting me? What are all these things doing to my immune system that is already very confused? And so fasting is really a way to step back, allow your body to reduce inflammation and support it to be stronger when you do start eating again. So whether that's a 16-hour fast, 18-hour, I know we just led a group through a fasting mimicking plan. So this degree of fasting can look different for every single person. But the general rule is that yes, taking a break from food will lower so many growth mechanisms in the body and actually help modulate your immune system. So anyone with autoimmune diseases, whether it is from cancer, chemotherapy that's induced, anything where the immune system is confused, you also have to be mindful of not taking anything that is stimulating your immune system. And that sounds so obvious, right? But in cancer, you want to stimulate your immune system. So that's where it's like that finding that fine balance of how can I retrain my body? And so it's attacking the right thing and it's not going into attack mode on healthy, normal cells. And so that's that fine balance that we're investigating, even digging deeper of why is this immune dysregulation happening in the first place, and looking at viruses, bacteria, parasites, what is throwing your immune system so off track that we actually have this extreme dysregulation issue and immune recognition where your body is not seeing cancer for what it is. So yes, fasting is the way to support that immune regulation piece.
Makes so much sense to me. I know I had kind of tapered off of the elongated fasting after the MG crisis and coming back from the hospital because I lost so much weight. I was terrified to eat and swallow and choke. So I know at that point, Janet had said, okay, maybe we shorten the fasting window and extend the eating window a little bit. But I think this is where, just as you're saying, it's like we're paying attention to what's happening and the symptoms that are presenting or how you're feeling or how your blood work is looking. And then we're assessing and changing as we go. But speaking specifically about thymomas, I know I had the honor of sitting with you and Janet and putting your heads together. So you were able to dive a little bit deeper into my case specifically. I know you've also worked with people who have had thymomas, but as we know, it's not apples to apples, even if you have the same diagnosis. So was there anything in my case that stood out to you or anything you'd want to elaborate on specifically about thymomas? I think bringing it up as the coach of your immune system really helped me paint a better picture of what's happening in the body.
Your consent, it's taking a full look at what have you done since birth. And that's where we take the time of doing a proper assessment of what are all the things that have led you to where you are now, because a thymoma doesn't just pop up out of nowhere. There's always clues along the way of what has created this metabolic issue and this dysfunction and what is going on. And so for you, we know that Epstein-Barr is absolutely playing a role in how your immune system is able to focus on cancer. And so think of Epstein-Barr, it can lay dormant and not make any noise in your system for a long, long time. So you may not even know, likely didn't even know. I'm not even sure if you knew that you had that prior to.
No idea. None.
Yeah. And so people who, you may felt tired or you just felt, you're getting sick often or just having symptoms where you're like, I wouldn't think that this is like a dormant virus. And then a lot of people can have this virus but not have a cancer, right? And so you think that how it is such a multifactorial issue where it's not just because Epstein-Barr that you, or like you said, eating too much protein or doing things like, it's really the accumulation of, okay, now adding on hormones to the body, which we know can drive proliferation. We know that it can affect how your body, how you methylate and metabolize, even turning these cells into healthier cells. And so for you specifically, it was such a cascade of multiple events happening. And then you add the stress of fertility and what goes along with that as well. It's a lot of stress for so many reasons. And it is the accumulated effect of adding on this viral load. Now we're dealing with autoimmune issues. Now we have like hormonal imbalances. And then you think about when you're stressed, how are you eating? Are you nourishing your body properly? Are you sleeping well? Okay. Is your whole circadian rhythm now messing up? Is melatonin now being affected? We know melatonin, which is produced from the pineal gland, plays such an important role in how cancer cells kill themselves, essentially. And so even just not sleeping properly for many years or being stressed and affecting cortisol levels, all of that together combined affects how your immune system is even able to recognize this process in the first place. So really tracking back, like looking at your labs and saying, okay, what are the growth factors now? How does your immune system look now? What is your VEGF and your galectin-3? What are all these growth pathways? What is happening to your system? And like, how high is your IGF-1, your insulin? We need to know all of these things because the viral aspect will play a role, your hormones will play a role, your gut health, how you're sleeping at night, how much you're moving around. And I feel like that was such an important part for you to remember what you love to do. Like, why are you fighting so hard to stay alive? What are the things that you want to fill your day with and really be inspired by again, and not allowing cancer to consume you to a point where you're making decisions that just are not congruent with how you want to live your life. So there's a lot to unpack there. And I feel like with your treatment plans, we're constantly tweaking other things that we can do. What should your diet look like? What should your fasting routine look like? Every single month, it is being changed. And it's something that we have to be on our toes for because we don't want anything to go in the wrong direction.
And that is why I love you and Janet both. It has been such a eye-opening experience. And I think when I think back on it, there have been symptoms that had presented, maybe not always all together at the same time, but I'm somebody who always looks back and it's like, well, when did it start? We may not ever know that, but like, what are the contributing factors that have gotten me to this point? But what's beautiful is then we're able to assess that and to target. And I do see, even just in how I feel, I mean, the autoimmunity is like a very obvious, visible symptom when it's flaring up. And I really have kept that at bay until we went through the chemo treatment again, and then it caused a crisis. But I've learned so much, and I've seen so many changes in a healthy way in my body from the perspective of sleep, from taking a step back from things that were stressing me out in my life, and pumping the brakes and setting my boundaries is like a huge theme I know in the MCR group. So I do want to spend a few minutes talking about that. But yeah, this whole way of working has just really helped me put myself in the driver's seat again, to not only, to your point, take care of yourself, but I also think like focus on what brings me joy and still allow that into my life. Because I think I was actually talking with a group of girls who all have a thymoma, some active, some inactive. And I had said to one of them who was asking a lot of questions, and I could just feel her stress. She was asking about the nervous system. And, I rattled off a few things that had helped me. And I'm like, I don't want to forget about joy, because I feel like when you are experiencing that, it's almost impossible for your nervous system to activate stress and fight or flight mode. They work completely in opposite directions. So thank you for
And
touching on
often too, that remembering of joy usually happens years before a cancer even is detected.
that.
It's years of losing focus of everybody that we talk to. It's very much doers, people pleasers, supporting other people, putting their needs last. It's a lot of neglect of your own happiness that's been happening for many, many years. And that's where, like you said, it's like now with a cancer diagnosis, not how to not allow that fear and that overwhelm and that intensity overtake your body, which really should have been taking a hold of decades ago, on how do you prepare for that, and how can you become more resilient, or remembering the joys of life. Even just having high cortisol and high stress will downregulate these tumor suppressor genes, and that is in the research, where cortisol and stress directly affect how your body is detecting and killing off cancer cells. So that's a big deal when you think of, I don't want to say stress caused the cancer, but it's that whole picture of inflation, definitely a big part in how someone's outcome will look. And I see the people who get the best results in cancer care, not only just doing the metabolic therapies, not doing, the supplements and doing all the things that you're supposed to be doing. It really does come down to this strong faith of, I'm going to be okay. I'm going to be okay. And I'm strong, and I am going to be great for than okay. Right. And it's that knowing and living each day to what fulfills you and what you love about being alive, and striving for that, versus this to-do list is getting so crazy and I'm letting other people down and disappointments and all these. So it's a huge part of it. So I'm glad that you share how you bring joy in your life. And it's a lot to remember too. Like you have to remind yourself constantly of like, oh yeah, what did I do today that actually, did I laugh today? Oh, did I even have something that I was super enjoyable and loved about today? And so really reflecting on that, because that is huge for your nervous system and how that affects your immune system and your gut and all of the things.
So true. Quickly, was telling my husband, a friend of mine who is a DJ, female DJ. She's like worked with a lot of celebrities. She posted, I'll send it to you because I think you would appreciate it. I was like, Nick, I can't wait for this. He's like, are you nervous to talk to Lori? I'm like, no. I mean, we talk every week in the program, but I said, you have such a beautiful spirit and like such a loving, fun energy. I remember when you came on to one of the MCR calls like months ago, you're like, I think we should have a dance party. And you started playing this like old school like reggae. I'm going to send you her playlist because I was like vibing to that before I got on this call. Like that's how I prepare myself. Like music for me is so therapeutic and so is dancing. But like whatever it is that brings you joy, we have to do it. That is what life is about. And I think a diagnosis like this can totally like make you hone in and focus on that specifically, but then you become even more stressed. So I do want to spend a few minutes talking about the MCR program and why you created it, because I know that from a support system, I've gained friends out of this. I've gained sisters out of this, brothers, and just like a place to talk to people who are like-minded and who get it. I feel so supported. I learned so much from these people. So tell me about this. What was your vision in creating it? And whatever else you want to share, because it's very special to me.
Yeah. Well, thank you for saying that, because it is something that I manifested a few years ago, where I'm thinking, after seeing the very first person with cancer, you realize 1 hour, and this is longer than any typical doctor visit, 1 to 2 hours of seeing someone once a month or every 3 months or whatever that structure could look like is not enough. There are so many questions that come up in between treatment plans. So you get this meal plan, you get this list of all the things you need to do, you really have this action plan to say, yes, this is how I am going to get rid of cancer. Like, this is the goal, and these are all the things that I have to do. Then you get home and it's like, what just happened?
What did you say again?
There's so many moving parts. And so I had to create a group where I'm not repeating myself 1,000 times. However, it's not even just that. It's really where I can be accessible in ways where it's like, hey, I have a quick question about, can I eat this? Or, I fasted and my numbers look like this. So what do you think I should do next? Like, these are on the spot questions that I do not want people to wait another week or 2 weeks and have to pay for another consult to get an answer from. I'd say 75% of the things that we're doing are really just for health. Like, everybody should be doing just for health reasons. So a lot of the conversations on all the calls are about building health every single week. And so this is something that when we join in a group setting and we make this community around how can we build health on a regular basis, it's reminding you that, you're not alone in this. And there's just so many great questions that come up where everyone's learning from one another. And that's what it should be about, because nobody learns about the mechanics of cancer in school. Nobody learns about how often you should be pooping and, what your poop should look like. And, you don't learn, you shouldn't have pain. If you have pain, that's your body's way to tell you something. Mm-hmm. Questions and things that can come up of us just understanding our body better. And so that was really the goal with the Metabolic Cancer Reset program, is how can we understand our body better? How can we build health on a daily basis? How can we have access to this platform and material and resources and meal plans and the community and really support one another on a daily basis? Because it's not enough just to go in for the one appointment and then, okay, let's see you in the next set of labs and I hope that they're okay. And, I hope I did everything right. I want to open up that door of, let's make you feel so confident that what you're doing is exactly what you need to do for the best outcome. Right. And it's that support where a lot of the calls, I go into tears listening to everybody and thinking, wow, what a powerful group that is here, where, prior to even creating this group, I thought a group calls would be really, and I think it's a lot of people's perceptions are like, oh, I don't want to join this another Facebook group where everyone's just kind of like victim mentality and bitching about things. I don't want to hear other people's problems, but as human beings in this group, there's good days, there's bad days. And to hear everyone, how supportive everyone is and like genuine love for one another is the most fulfilling thing, that I get so excited for these calls, and just hearing how everyone is just so like pouring love onto one another. And like you said, developing friendships and going through things where it's like, you don't want to talk to your partner about it all the time, or you don't want to like tell your friends and talk about it all the time to people who really don't really get it, for one, but then also you don't want to make your relationship all about cancer. And
I was just going to elaborate on that. I mean, one, I am such a learner. That's one of my top strengths. So I was so overwhelmed in the beginning. So when I joined the program, not only did I have like somebody holding my hand and guiding me, and a community that I didn't even know that I needed, because I was very hesitant to show up on the first group call. I had like one eye open, if you remember, like, I mean, there's been a couple times I've been like that now over the last year, but it was just like, I don't belong here. I couldn't accept what was going on in the beginning. And it was like a more intimate group, I think, in my initial call, but I like exploded with emotion. I ended up crying. I don't even know what to say. And then you realize everyone has those bad days. But in addition to having your support in the one-on-one, having those group calls every week, you also have a whole program to dive deep into. So I was like, great. This is a way for me to take all of my learnings offline outside of that dedicated time in our sessions and learn. You spent so much time because you've done all of this work and you know the common questions that people ask. You have videos already prepared to take you through and learn about fasting and ketosis and how to test your blood sugar, all the meal plans. There's so much information there that in the beginning, it's almost like, oh my goodness, I don't know where to start. But as the conversations unfold and as you start to learn more about yourself in this case of the diagnosis and what you can do to help yourself, it's all these extra tools and resources in your tool belt. So that for me was huge because I love to learn. So I just totally took it all in and, absorbed it like a sponge. So that was a huge asset to the program as well.
yes, and like you said, like the overwhelm, because that's the nature of the internet and the world of so much information out there, but to have a process and a plan that's personalized, and to be able to dig into this material on your own time. So it's not the stress of having to get through so many things. It's like, okay, I have a question about this. Let me learn about it in this snippet of information and how I can support my body and understand, because that's such a big part of any cancer treatment plan is, why are you doing it? Not just because someone told you to do it or you heard online that it's the best thing that you should be doing. It's why. Why are you, like we talked about at the very beginning of the call, having all the resources in the platform, understanding what the labs look like, how to test yourself, what to test for, all the things of why am I doing this for my body and how is this going to help me? I really do attract people like that want to understand how they can not fuel their cancer, how they can have a surgery and make sure the cancer doesn't come back. And how can I best equip myself to understand my body, where I'm building health every single day and I'm focused on health and energy and feeling amazing and motivating and doing all the things that I love to do. So I feel very grateful that I attract badasses like you. And it's very people who are excited about learning these things and they want to learn, because I've had over the years where just say I help someone with their cancering process, they would say, I'm going to send my cousin here because we got such good results. My cousin doesn't really believe in this, but the cousin would come sit in my office kind of with his arms like folded over. He's like, yeah, so what are you going to do for my cancer? Like what, you did this for him. So do I have to do that? Not wanting to change, not wanting to acknowledge anything, wants me to fix the cancer. And it's like, this is not going to work. This is just not going to work. So I now have a screening process where anyone prior to coming into MCR and this program, I have to make sure it's a good fit, because you have to want to be there. Like you have to want to make these changes and acknowledge, and you can use the program however you want. You can watch the videos later. You don't have to be part of the calls. You can watch some of the material and take out what you need from it. But yeah, if you're coming to see me just because someone's forcing you to or said it was a good idea, I can tell you right now, it just won't work. It's not going to happen.
Yeah, no, I see the trends in, the personality type and also the mindset of people who come to this group, and they want to learn and they're ready to do the work. And I don't know that everybody who, I'm not, again, I never poo-poo anything on here. You want to go just conventional, that feels good in your body, that's what you do. But I don't think those people are necessarily looking to problem solve. They're looking for just like, maybe not a quick fix to the problem, but they're just looking for, okay, I have a problem. Here's the answer. Here's what we're going to do. And they don't necessarily think about or realize that there can be long-term side effects. So I feel like the people that come to this program really are learners and they want to thrive well beyond their diagnosis. So it just makes me feel like I'm in the
Exactly.
best hands.
Exactly. They have much bigger goals than just killing cancer, much bigger goals for themselves and how they want their life to look, and bigger aspirations than just saying, okay, I'm killing cancer, but I'm also dead inside. Like that's really the reality of a lot of people who don't change anything and just think this pill is going to be doing the job. So that's the exact mentality of thrive, address the cancering process, and feel alive, like feel more alive than you've ever felt. So it's a really amazing energy that we have. And there's, sharing tears and praising one another. Like, wow, this is what my oncologist says. Like, never seen someone respond so well. And, like, this is amazing. And just these testimonials that we're hearing, this is why this group is happening. This is exactly the purpose.
Yeah. Well, I think that's a great point to wrap. I also want to be respectful of your time. I have one final question. Everyone in the MCR group, I just want to say we're so grateful for you for devoting your life to this work. I would love to know what keeps you moving forward in your life, in your career, wherever you feel like that question lands for you. What keeps you moving forward?
It's really people that are courageous. Like I wake up thinking about treatment plans for people. I go to bed answering questions about, like, there's so many moving parts in my life. My life is so full with so many different things, but what gets me up out of bed is really learning how I can help make people healthier, how they can understand their body, and help should not be hard. Life should not be so stressful. Life should not be full of fear. And when I see someone struggling, it like hits me at the core of I can help find other ways so they don't have to live like that. And that is something where I feel strongly of my purpose of educating and helping people know that there's other options and there's other things you can do. And that is why I continue doing what I'm doing. Like sometimes I think, wow, cancer is such a heavy topic, and how am I, it's a lot to take on, but it's also the most like fulfilling thing that I can work with people who are so passionate about life and want to live and are so grateful for everything. It's such a different atmosphere than, oh, it's a cancer that's, everyone's depressed and angry and going into this like doom and gloom atmosphere. It's not like that. It is so inspiring, and it's so inspiring to see what the body can do and what it's capable of. And it's people like you and even your listeners who are just showing miracles every single day. And that is what moves me forward, seeing these live miracles happening.
I feel the tears right now. Yeah, I mean, I can't imagine how, I don't want to use the word heavy, but like how full that can feel on your shoulders to carry all of that. But I think you do it so gracefully, and you have a huge heart, but also like a very intelligent brain. And you hold this vessel for us in a way that is just, it's so comforting in a time in all of our lives where it can feel like the world is upside down. So I just want to thank you for that.
And I think it's common where, you also as an empath, you take on a lot of emotions and you feel other people's feelings and you take it. So it really is learning the tools on how to, what we're doing in the call, have a shake off party of how can you release that heaviness and how can you mind yourself, like get that stagnation, get it moving. And I, just like everybody else, have to remind myself of, okay, I need to prioritize me time. I need to do all of these things that help me just why I'm doing what I'm doing, but not feel burnt out by it.
Yes. Yep. You have to walk your talk, right?
Exactly.
Awesome.
Exactly.
Well, Dr. Lori, thank you so much. This means the world to me. I feel like you shared so much information here. I know I had a lot of questions for you. Maybe we do a part 2 because I know I didn't get to some of them, but this is going to be so helpful for so many. So I appreciate your time and just thank you so much for doing this.
Amy, I'd really enjoyed being here too. And yes, to a part 2. Let's do it.
Sounds good.